Good morning, Professor Che, colleagues, ladies and gentlemen, students. Welcome to this pair seminar. My name is Qing Chen. I'm the director of the Purdue Academy for Interdisciplinary Research, or PAIR. So it's my great pleasure to introduce today's speaker, Professor Chun-tao, who is also a PAIR fellow. And he's currently a Harry H.S. Fong Professor of Pharmacognosy at the University of Illinois at Chicago. So Professor is a key figure in advancing the profession of Chinese medicine and its early development in Hong Kong. In the late 1990s, the Chinese University of Hong Kong established the first institution on the School of Chinese Medicine, and Professor Che at that time was the director, and he really contributed a lot to the establishment of that school. So he, of course, did a lot of at the Hong Kong, the Chinese University of Hong Kong in terms of education, training, research, and development. So his approach in the Chinese medicine is highly interdisciplinary. With over 40 years of experience, Professor Che integrated the knowledge and the techniques from botany, chemistry, and from pharmacology to discover, isolate, and useful substances from medical plants. Such endeavors are particularly important in driving the rational, evidence-based application of Chinese medicine in modern practice. So his research addresses the health-related topics, investigating into the anti-obesity, anti-depressant, anti-cancer, and the liver protective effects of plant-derived natural products. For example, his team demonstrated how a group of compounds known as ginseng supplements might inhibit prostate cancer by suppressing specific gene expression. Another example is by working together with the international collaborators, Professor Che investigated the inhibitory effect of plant leaves on ovarian and skin cancers, and also established the plant toxicity profile. So at the University of Chicago, Professor Che also leads the WHO collaborating centers for traditional medicine, contributing scientific and technical expertise to support the WHO's implementation of its traditional medicine strategy. So his work is well recognized in the modern society, not only in the Eastern, but also in the Western. So without further ado, ladies and gentlemen, please join me in welcoming seminar speaker, Professor Che.
Well, thank you, Professor Chen, for your kind introduction, and good morning, ladies and gentlemen. First of all, I would like to thank Professor Chen and PAIR for the kind invitation, and I am so glad to be here today to meet colleagues and friends who are interested, who share the same interest as I do on Chinese medicine. So what I intend to do today is to give a brief discussion on geriatric health from the perspective of Chinese medicine research. So my goal is to promote research and studies in order to help the older adults or our elderly population not only to live longer, but better. Let me see. Okay. According to the World Health Organization, by 2050, 1 out of 4 people you meet will be over the age of 60. And this unprecedented demographic shift raised 2 fundamental questions. One is, why should we be concerned about the aging society? And also, what can we do to support healthy aging? And aging society is a big concern, not only because it has a lot of medical implications, but also it involves a multi-dimensional impacts on touching on almost every aspect of a society, such as the social values and family structures, economic and workplace dynamics, ethical consideration in healthcare and care for the elderly, and infrastructure and environmental demands, okay, to accommodate the elderly population. And of course, it imposes a pressure, big pressure on health and healthcare systems. So in today's presentation, I would only focus on health, okay, the health issues. Now, as far as geriatric health and healthcare is concerned, the most challenging issues are associated with the burdens of chronic diseases, morbidity, and polypharmacy. People are taking more and more different kinds of medicines. And then also it deals with the functional decline and disability of the elderly. And then the quality of life can be compromised in many of those older adults. And of course, long-term specialized geriatric care is important, okay, to help those who are in need. So the question for us to answer is, when we are facing these health challenges, what can we do to support healthy, meaningful, and dignified aging? Okay. Now, we all realize that in the aging population, the most common problem are heart diseases, stroke, and chronic pulmonary disorders. And in fact, these are on the top of the causes of death in the elderly. At the same time, conditions like sensory impairments, chronic pains, depressive disorders, falls, diabetes, dementia, and osteoarthritis, these are all major reasons why many elderlies lost their quality of life, mobility, and independence. So the question before us is not simply how long a person can live, but how well they can live with dignity, right? So Chinese medicine has its own way of interpreting aging. Now, instead of describing specific diseases like heart diseases, stroke, etc., it took a whole body view that would lead to illness. And so while a full discussion of Chinese medicine theory is beyond the scope of this talk, there are several key concepts worth noting as we are growing older. Now, our qi tends to decline or become stagnant. These are problems or a general trend that happens in the elderly population. And blood circulation slow down and may become stagnant. This is another issue that a lot of elderly people are facing. And then phlegm and fluid tends to accumulate in the body. So diagnosis of these patterns or the constitutions of our body in patients or in the elderlies will guide us how to approach prevention, and treatment, all right? But of course, we have good news. The good news is many these age-related health problems are not inevitable. They can be prevented. They can be postponed, and some can even be prevented depending on how we choose to live, right? So with the right lifestyle, timely intervention, and a better understanding of the aging body, older adults can live not only longer, healthier, but more fulfilling lives. So in this context, Chinese medicine aims to support the body as a whole, okay? And it brings a set of values that align naturally with geriatric health. And two principles summarize this beautifully. 鸡妹病, illness prevention, and 养生, okay, nurturing life. The idea of preventing illness is to emphasize proactive care instead of reactive treatment. So we have to do things before disease or any undesirable condition starts. And then it also emphasizes on intervening early before the disease become severe. And then the concept of nurturing life deals with protection and preservation of vitality through lifestyle, emotional balance, movement, diet, and proper rest. So altogether, this principle will shift our attention from treating illness to maintaining harmony within our body, from managing decline to building resilience, and from reacting to problems to nurturing stability and dignity. So how do we translate into practice? In the real world, Chinese medicine offers many tools and many different ways to prevent and to support healthy aging. As all of you know, using herbal treatments, acupuncture, moxibustion, and the movement therapies like Tai Chi and Qigong, and dietary and lifestyle guidance. So they invite us to look beyond the treatment of individual diseases and instead focus on maintaining internal harmony, okay, a balance between yin and yang, qi and blood component. The goal, of course, also is to nourish the vital organs, to strengthen the resilience, and to enhance the overall quality of life. So in practice, Chinese medicine approach offer our older adults the pathways to maintain mobility, to preserve cognitive function, to manage chronic conditions, and also to live with dignity and comfort, right? So when we integrate our rich knowledge, we have to integrate our rich knowledge of Chinese medicine with thousands of years of clinical experience together with evidence from research, and then we can make good use of Chinese medicine for maintaining the good health of the population. Of course, not including the geriatric population. In fact, it's good for everyone, right? And so we have to realize, that at this time, when we integrate, we have to admit that the research on Chinese medicine is promising. First, I think we have to admit it's promising, but it's still growing. Okay, so current scientific and clinical evidence of the benefits of Chinese medicine often inconclusive and sometimes can be controversial to many people. So we must therefore commit ourselves, okay, to scientific to research, to do more research. That's my goal of this lecture, in fact. It's to promote the research to strengthen the foundation of Chinese medicine, ensuring the quality, the safety, and effectiveness of all different kinds of Chinese medicine practice through vigorous research, modern technologies, and collaboration. And with that, I think I'm sure the Chinese medicine can be applied in our modern society to improve geriatric health. Okay. And so when we do this, I believe our goal is not to argue whether Chinese medicine works or not work. Okay. Instead, I think we need to identify what works, how it works, for whom it works, and when should it be used. This is, I think, our goal when we get into the researching Chinese medicine and promoting the use of Chinese medicine in our societies. So in this talk, I will focus on an overview of current research findings that have shed light on the potential role of Chinese medicine in supporting geriatric health. Specifically, I will focus on 5 areas that are most relevant to geriatric health. Supporting cognitive function and brain health, managing pain and mobility issues, strengthening immunity and preventing illness, digestive health and nutrition absorption, as well as managing sleep and emotional well-being. So frankly, we must admit that many reported studies, well, there are many reported studies, and I'll show you some later, on studying Chinese medicine for the benefits in these areas. But we have to admit that many of these reported studies vary in both quality and the strength of their conclusion. And so realizing these limitations, I will not attempt to single out any specific, say like a herbal formulation or any specific acupoint or any specific particular exercise styles that as the best. Okay, I'm not going to do that, but instead my goal is to highlight the broad trends, okay, and emerging evidence that point to the potential contributions of Chinese medicine to healthy aging. Right? And importantly, also, current available information should be interpreted as supportive rather than conclusive, right? And it highlights areas. In fact, it helps us to understand some areas that of promise and significant that show us some significant research gaps, underscoring the need for new insight, new efforts, and new directions for future development. Okay. Okay. Now the first area, supporting cognitive function and brain health. You know that when we age, cognitive function may decline. And the early symptom includes the mild cognitive impairments, MCI, which is very common in the elderlies. And so what is alarming is that the prevalence of MCI is increasing worldwide. And so this is a topic that cannot be neglected, right? And early management of cognitive decline is therefore crucial to prevent or to slow down the progression of dementia. Unfortunately, currently, there are only a handful of medication or drugs that are used worldwide to treat dementia and cognitive decline. And as a matter of fact, most of them are symptomatic for symptomatic treatment with no guarantee, okay? In fact, there's no cure, all right? And recently, more recently, there are a few antibody therapies now in the market, but again, the actual outcome is not certain, and for sure, all these medications will have some undesirable side effects. So many elder individuals then turn to herbal formula or acupuncture, right? And these Chinese medicine approaches generally aims to tonify the spleen and kidney, according to the Chinese medicine theory, and to promote circulation and remove phlegms and to nourish the brain. So these are the basis, okay, based on Chinese medicine theories for treating cognitive decline. So in the literature, there is a substantial body. If you go to the literature, you search in the literature, there's a substantial body of evidence examining the use of Chinese medicine herbs for mild cognitive impairments. You'll find many, many papers in this area. And so I will just briefly show you the results of a couple of meta-analysis and systematic review. One systematic review highlighted the benefits of herbal treatments, and it's illustrated in this forest plots. The meta-analysis demonstrated that Chinese medicine intervention produce measurable improvements, okay? Just make it simple, you can see all the lines on the right-hand side of this vertical line. That means it shows some benefits, right? And in each line represent a study. So there are many studies, and these are meta-analysis studies, right? So the results seem to support that herbal treatment has some effects, okay, has certain effects on helping slow down the cognitive decline, right? And based on different criteria, and I'm not going to dig deep into this. And the same review also emphasized the role of ginkgo, right? If you are interested in herbal treatments, I think in the literature, probably ginkgo papers dominates all the literature regarding the use of herbs for memory improvement, for slowing down the progress of decline. So this it shows you again that, well, in this case, the effectiveness is on this side. All right. The ginkgo, there are many studies that this particular paper summarizes that ginkgo has some effects, okay, on the cognitive decline. And this conclusion echoes an earlier work, and in a systematic review that includes more than 2,000 participants, ginkgo was found to be more effective than placebo. And although you have to be cautious that the author also warned that the precise clinical relevance still requires further confirmation. And earlier this year, this diagram here. Earlier this year, there is a retrospective study provided the real-world evidence suggesting that ginkgo use, which is shown in the green line here, is associated with a reduced risk of dementia severity progression. And many Chinese medicine formulas also demonstrated potential effects, right, in animal studies to enhance cognitive function and neuroprotection through multiple biochemical pathways. So in these papers, you can see that the authors not only demonstrate some effects of these Chinese medicine formulas, but they also pinpointed to some mechanistic targets of the formula. So I'm not going to explain all these targets, but and also you have to note that this is not human data, but these are animal data. But these mechanistic findings that provides encouraging and point to meaningful avenues for further research. And now this slide shows two recent meta-analysis studies on the clinical effects of Chinese herbs on MCI, on mild cognitive impairment. One using only, so for these studies, it used only Chinese herbs. And the other ones is a concurrent combination of Chinese herbs plus a donepezil, the drug, okay, the medication. And conclusion indicated that in both cases, okay, the Chinese medicine holds potential to improve cognitive function in MCI patients, although the evidence quality was determined to be only moderate to low due to methodological weaknesses of the studies. So this is something that I have to repeat and repeat that when you look at the results of the reported studies, you have to bear this in mind, how the quality of the experimental design and the level of evidence that you should have to be concerned about. Now, for many many health issues, an emerging area that you know is the microbiota gut-brain axis, right? And an imbalance in the gut microbiota has been linked to various cognitive issues and neurological conditions, okay? Such as the neurodevelopmental disorders, mood and stress, and neurodegenerative diseases. And so it has been postulated that in older adults, there is a change in the microflora in the gut, whereas the good, so-called the good guys, the good bacteria decrease while the bad one rises. Okay, so and there has been some reports that these changes in the microflora has something to do, can be related to the cognitive function. And so this table shows some studies with herbal formulations. Using these herbal formulations, it has been shown that the microflora profile improves, okay, in terms of the retaining more of the good guys and preventing the appearance of those, or the increase of those bad guys. And these changes seems to be able to correlate with the cognitive function. Okay, and of course the field of gut-brain axis is a fertile area, and while current data are insufficient, so far is insufficient to draw any conclusion, but emerging research has provided some hints, at least there are some hints that gut bacteria may impact age-related cognitive function through production or modulation of neurotransmitters, or regulation of the immune system, or influence on the body's stress response system. So this is some areas that you may be interested in if you go into this direction. All right, and this is all for herbal preparations. Oh, yeah. How about mind-body therapy for cognitive functions? Now, Chinese medicine exercise therapy, such as Batin Gum and acupuncture and Tai Chi, have been shown in systematic reviews and meta-analysis to improve attention, to improve executive functions, and improve memories in patients with cognitive impairments. And again, this shows the results of a meta-analysis of the effect of Batin Gum, on cognitive function and memory function. And in several studies, the result shows favorable talks, the exercise, all right, using the exercise. And in another meta-analysis, Tai Chi and Qigong. Tai Chi and Qigong appears to improve. Also, the result shows that they appears to improve executive function, the memory, the visual, spatial function, and the global recognition in older adults with mild cognitive impairments. I'm sorry, I just keep showing you all these forest plots. And then in another studies involving a lot, I think it's almost like 2,000 patients or subjects, acupuncture combined with Qigong and also Qigong itself and Tai Chi itself, they all shows some good results, okay, to improve the cognitive functions. Now, talking about acupuncture, acupuncture also shows some, in many studies, the use of acupuncture also demonstrates good results. So I'm not going to dwell on this anymore. So this diagram just to show you that in the literature, we do have positive results regardless of the quality or the exact quality of the studies, right? And at the physiological level, mind-body therapies have been shown to improve cognitive functions through various mechanisms. So like improving neuroinflammation, improving synaptic plasticity, etc. So these are the possible mechanisms that acupuncture and exercises can help, may add on. Okay, so these will just become targets of future research if you're interested. So we can just look, try to establish the mechanism of the exercises and acupunctures. So again, so this is something that you can keep in mind. All right. Now, the next area, pain and mobility. Pain management is a global public health priority, as you know, and chronic pain is a significant health challenge, particularly in the older population. Chronic pain creates profound disruption across all dimensions, in fact, all dimensions of seniors' lives. Beyond the physical discomfort, it significantly impacts the mobility. It causes low sleep quality and less independent, and also it may impose some emotional issues in the elderly populations. So while non-steroidal anti-inflammatory drugs and even steroids or opioids are used, and there's no treatment protocol that can be considered as the method of choice. So they all have their shortcomings. And so for Chinese medicine, it views pain as a result of qi and blood blockage. And so as far as Chinese medicine is concerned, other than herbal medicine, the use of herbs, or Chinese medicine also offers several pain management options like acupuncture, moxibustion, cupping, Tai Chi, Qigong, Chun-tao, etc. And they can all help alleviate inflammation, improve circulation, and enhance flexibility and balance. So for acupuncture is, of course, as you all know, has been widely used worldwide for pain control, and particularly chronic pains. And again, this slide shows the meta-analysis of the studies using acupuncture, different kinds of acupuncture, and electroacupuncture, and the auricular acupressure, etc. And they also some positive results, okay, for pain control. And also again, these are the results of several studies on the pain intensity and the back pain back function. Okay, so this all shows positive outcomes. And there was a studies of Cochrane report in 2020 on the oh no, sorry, this is a studies or as a project called Back in Action, and by using acupuncture for treatment, and again, this just demonstrates that the acupuncture group show better results 6 months, even 12 months after treatment. All right. So acupuncture controls pain through a lot of different mechanisms, and many of these mechanisms has been shown, but at least in animal models. Now, regarding herbs, a lot of different kinds of herbs and formulations also have been used for controlling the pains, and here I just include a few some examples of common herbs that are widely used in Chinese medicine for pain control. Right. All right. Now the third area, I think I have to speed up. Strengthening immunity and preventing illness. As we age, the immune system weakens, and making older adults more susceptible to infections and chronic illnesses. And some Chinese medicine is strong, is strong in preventing illness and nurturing life. So its preemptive regulatory model aligns precisely with many, with the modern concepts, okay, of integrated preventive healthcare and personalized resilient-based wellness strategies. And through practical practices such as dietary adjustments, acupuncture, and physical exercise, Chinese medicine can support, okay, varieties of effects or benefits in the elderly. Now, to explain the concept of prevention, disease prevention, there are several physiological grounded explanations, okay, such as maintaining homeostasis, establishing allostasis, and early dysregulation of physiological upset, etc. So these are the physiological basis that we believe that the Chinese medicine can attain the purpose of preventing illnesses. And since Chinese medicine postulates that pathogens invade only when internal defense is weak, So it supports to strengthen the immune resilience to prevent weakening of the innate immunity, or reduce to prevent reduction of the T cell repertoire and etc. So these are studies that have shown, that Chinese medicine can affect and can manipulate or to have impacts on the physiology to deal with strengthening the immune system, right? And yeah, and there are a number of formulations that have been shown to be effective. And I just want to show you a few that has been more better studied. And well, yeah, there is a report of a modified what is it? Modified yeah, that will help the elderly populations to prevent flu, common colds. Okay, so yeah, because of the time, I'm not going to go into the details of this. And then there is another studies to show that the formulation, some of the herbal formulation, can reduce the cases of rehospitalization of pneumonia. And then also, there is another studies to show that some the formulation can enhance the different physiological parameters. So these are some studies that's showing the effect of herbal medicines. And then apart from the formulations, of course, there are many herbal drugs, herb or single herbs or Chinese medicine herbs that have also been demonstrated to have effects on the immunomodulating ability. Yeah, so these are some mechanisms that are believed to be happening when acupuncture is used to strengthen the immunity. And so let's move into the digestive health and nutrition absorption. Aging can slow down digestion, and leading to issues like bloating and constipations or nutrient deficiencies. And TCM places great emphasis on improving digestion and nutrient absorption in the elderly by focusing on strengthening the spleen and stomach, promoting qi flow, and also resolving dampness or coldness in the body. And that's the Chinese medicine theories relating to digestive health. And yeah, some possible mechanisms could be understood through modern physiology, such as shown in this table, strengthening strengthening spleen qi may have some effects on increasing the enzyme secretion or increasing mobility and absorption and increasing energy metabolism, etc. So these are some the physiological basis for us to better understand the Chinese views, okay, on the spleen stomach functions. And then, of course, in the literature, there are many studies on the effects of Chinese herbs related to improving digestive health, including to strengthen the qi, to replenish your blood, to strengthen your spleen, and nourishing yin, and warming the yang, and also some digestive functions. So these are, in many cases, a combination, okay, of these herbs will help to improve the digestive health. And then Chinese formulas, the Chinese medicinal formulas, here are some examples, also have been found to be able to improve the digestive health, okay, and depending on the specific situations, of course. Then besides herbal treatment, of course, acupuncture. Okay, it seems acupuncturists can do everything, right? And acupuncture has also been shown to be able to manage our digestive disorders. Okay. Okay. The last area, I'm told to stop, but anyway, I just rush through this. To manage sleep and emotional wellness, which is an important issue for many elder adults. If you don't sleep well, then of course there are a lot of ability will be lost. Okay, a lot of functional disorders will happen. And then the common sleep disorders in the elderly includes insomnia, sleep apnea, and some movement disorders. And so lack of quality sleep can lead to a lot of problems. Okay, and in the elderly, I think this is a lot of us know about this. And so effects of acupuncture. Acupuncture has been pretty commonly used for sleeping issues, sleeping problems. It has been shown, okay, to do several things that would improve the sleeping quality. And also for improving emotional wellness, right? Here, just some examples of the study. Ooh. Yeah, this is just more study results on using acupunctures, okay, to improve sleep. So I sorry that I have no time to go into this. And again, herbs, okay, can be useful. And these are examples of herbs that are good for managing sleeps. Okay. And these are examples of formulations, okay, the herbal formulations that have been reported, okay, to improve sleeping quality and also to calming the mood. All right, now let me, okay, this is another studies, and I believe this study was done here by Professor Jerry Young on the depression. All right. All right. I'm sorry that I have to rush through the last many slides. And so as our society grows older, we are challenged not only to treat diseases, but also to protect vitality, to preserve function, and to uphold the dignity throughout the later lives. And in this context, we have considered Chinese medicine not as a replacement, as for the modern healthcare, but as a complementary partner, right, within the broader continuum of aging care. With that said, we need also to acknowledge that the current evidence basis for Chinese medicine approaches remain uneven, and these limitations underscores the need for cautious interpretation and continue scientific scrutiny. Further, many more studies have to be done, and so it is clear that the demands for holistic and integrative approach to geriatric wellness is growing, and the need for both robust research and well-designed clinical trials is imperative. And by thoughtfully combining biomedical and traditional knowledge, we can work towards optimizing care for our older populations, including myself, of course. And I'm sure that we all agree that they deserve nothing less. All right. With that, I want to thank you for your attention and I wish you all Happy New Year. Thank you.
Professor Chen, thank you for the very comprehensive presentation.
You're welcome.
Now it's the time for me to do the Q&A sessions. And of course, I think among the crowd, they might have other questions, but I already have some questions here.
Oh.
So I will probably first raise the first question. Now, how can we shift the general public's misconception about TCM, such as the widespread view that Western drugs are quicker and more effective, and that TCM mainly focus on wellness and preventive care? What do you think? Yeah.
Well, I think the concept that Western medicine is quicker and more effective, while Chinese medicine is specializing in more preventive and long-term care. I think the general concept is true to me. In most cases, I do agree that the Western medicine would act much faster. But acting faster, whether it's good or not, and there's something that we have to consider. Of course, for Chinese medicine, it is known to be good for chronic conditions. And also, I think the beauty of Chinese medicine is to build up our own body's resilience and response to the outside, to the environment. Now, so the question is how we can change the public's image of this. I think education is important for the general public. In the last few years, I can see that in Hong Kong, there has been a great step in developing Chinese medicine. We have graduated, I don't know how many new Chinese medicine practitioners with the degree programs, and they are all practicing. And I think Chinese medicine clinics are opening up everywhere now these days, and that certainly will help people to think about the use of Chinese medicine. And particularly in the younger generation, I believe they have more trust on the younger practitioners. And then with the opening of the Chinese Medicine Hospital, I think there's another important step that to change the mentality of the public, that they can now turn to Chinese medicine for certain kind of conditions. And of course, public education is also important.
Now, since you bring up the Chinese Medicine Hospital, I have a question related to that. Okay, so one of our students from logistics is wondering how can we more effectively integrate it into the automated dispensing center in the Hong Kong Chinese Medicine Hospital. So I think it's a more technical questions. How can we do that more effectively?
I think more automation is a trend, okay, to do a lot of things. Of course, the dispensing of Chinese medicine can be automated. In fact, in some bigger clinics, there are some machines that I saw that would just prepare the mixture of the formulation automatically. I'm not good in this area, but I believe this is what the question is about. Now, in the Chinese Medicine Hospital, I have no idea how they are doing it, or whether they have any plan to do that, the automation of dispensing. But as far as I'm concerned, I believe this is a good way to go forward. I know nothing about the technical side, how you can do this, but I'm sure there are machines already out there that can help.
Now, since we are talking about the Chinese Medicine Hospital, we might not have all the answers, but I'm going to bring this up, okay? The question is about how we can integrate like TCM and Western medicines in a way that provide better treatment for patients. It's a very broad question, but I want to kind of add a little bit of my own question to this, because I think PolyU has been very strong in allied health. So it's not necessarily just the practitioners and the physicians from the Western world, but more like how do we integrate maybe our physiotherapy or our training, like speech therapy, or we have all kinds of things, okay? So how can we provide a better treatment to our patients? How can we do it in what way?
Okay. Well, I think first, within PolyU, I think you have already set up good examples of interdisciplinary research and also interdisciplinary treatment programs. But as a whole, I think collaboration or integration start with understanding. I think it is the most important thing is for the different stakeholders to understand one another, okay, particularly between the Western medicine and the Chinese medicine sides. And so communication and more frequent interaction, I believe that's the basis, okay? Is when you understand better yourself and better you understand the other side better, then you know what you can do together, okay, to complement in a complementary manner. And I think at this time in the Chinese, you mentioned the Chinese Medicine Hospital, I think one of their strategy or one of their plans is to start doing some integrative service, as far as I understand. I'm not totally sure, but that would be a good start. And as I know, some private doctors and Chinese medicine practitioners, they are also having some small scale integrative programs for their patients.
Yeah, but I think based on what your talks today, we do need a lot more evidence-based research,
Yeah.
to support the integrations, right? So I think we might come back to that because we still have long list.
Yeah, okay.
Okay, I have a few questions. Actually, you mentioned almost at the end about the insomnia. So a few questions from our floor is to talk about what kind of Chinese medication can use to improve both quantity and quality of sleep? And then there's another one asking the best effective ways to deal with insomnia and how to improve sleep quality. So it seems like probably you friends and colleagues have problem with sleeping. So,
Many people do.
Yeah, your answers.
Well, in general, I just pointed out that both herbal formulations and acupunctures and like the Tai Chi, and they all help. Okay, there are plenty of evidence, pieces of evidence that shows that they all help. But one thing that I want to emphasize here is that if one is interested in using Chinese medicine, then you have to get a proper diagnosis of your body types, of your body constitutions, so that the proper medications can be applied. Now, Chinese medicine, unlike is not the same like Western medicine. They are treating your body constitutions instead of just a symptom. Okay, so if you have you cannot sleep well, I cannot sleep well, but since our body constitution is different, then you need to use different ways of Chinese medicine to deal with it, and so my simple answer is there are a lot of herbs and there are exercises, there are acupunctures available for treating sleeping issues. But the first thing is for a person to find out their own body constitution so that the best or the most appropriate ways to deal with that.
Okay. Now, I have a question related to menopause and perimenopause. And of course, it's also including sleep problem, but there's also other like poor, reduced immune functions or other quality of life. So what evidence-based TCM intervention can both ease the menopause symptoms and enhance long-term physical resilience for healthy aging?
Well, I have to admit that I don't really have a lot of information in this area, but I am sure there are studies of different modalities, both herbal medicine and pulmonary acupuncture can provide some beneficial effects. Since I'm not a clinician, so I'm not able to answer this.
Right. Now, you mentioned about the mobility problem. So there's a question related to whether acupuncture is recommended for arthritis. Have you come across any of those literature?
I think yeah. I think after acupuncture has been applied to arthritis, and I cannot recall exactly what acupoints they use, but for sure, yeah, there are reports, and I think many practitioners are actually doing that.
Okay, now, so come back to something more on the drug side. Okay, so I have a question related to the bitterness of herbal. So TCM usually face a barrier for consumptions due to people that they are not familiar with them, and also the taste. So do you have any suggestions for overcoming this barrier?
I like the bitterness. Anyway, yeah. Well, in the last many years now, we have those granules and tablets, capsules, prepare from herbal drugs and from different formulations, and at least I think the capsules and the tablets can solve this problem if bitterness is a major issue. But if you have trust in Chinese medicine, I would encourage you to overcome the barrier.
I guess not all herbs are bitter. Okay, so it leads to my next question. Now people are talking about food and medicine sharing the same origin. Okay, because some of the herbals are being used as food. So if they are really bitter, I don't think anyone would like it. So how should we understand this theory in TCM?
Well, there's a history, all right. In the very early days, when people pick up different plants, different things around within in the environment, and they try it, and some taste good, and then some they find some can cure some diseases or make you happier or make you healthier. And so that is how it arises. So this is the same origin, I think, referring to the same process when they were discovered, that either they have nutritional values or medicinal values. And so it happens for some herbs, they have both the nutritional values and medicinal values. As you said, of course, these with dual properties usually are tasting better, and so people can more receptive or in making foods, okay, making your dishes with this. But at the same time, the beauty is they also can modify or change your physiology, so that they can deal with some conditions, diseases.
Okay. Now I have one question from a young pharmacology scholar, and he wants your advice to how to initiate a Chinese medical research project.
Wow. How to initiate a Chinese medicine project? First, you have to have some idea what you want to do. Okay? And then I think its first thing is to define a target. What kind of pharmacology you want to do? And of course it depends maybe on your interest, depends on the resource available to you, and also depends on the relevance to the medical or biomedical areas. So you just pick a project, a target that you want. And the second thing, then, of course, then you look into the literature to see what kind of Chinese medicine modalities or what kind of herbs or acupuncture or whatever have been shown to have some effects on your target physiology. And then from there, you find a niche of find out what is still lacking in that area, so that you can work on something that to improve whatever knowledge already exists there. And then, of course, funding is important.
Now, just based on what you said, the research gap is something that they need to know. Right?
Yeah.
But you're an expert in pharmacology. The resources is one of the issues. Like, should we find a very common herbal, or we should find a very precious one that is like in the place where very difficult to collect? So would that be a factors to?
Oh, yes. Yeah. Selecting what herbs to use is also crucial to your success, all right? I think then it depends also on what kind of outcomes you want. If you want to, say, develop a supplement, then probably you need to find some herbs or something that are more commonly used and more well known to people. And also, of course, the bottom line is no toxicity for anything you choose, right? And then also you have to consider how you can get the materials to start with. There are many materials, herbal materials that are not easy to get. And then, of course, then one option is to collaborate. And so collaboration is another issue. Then you need to work with other expertise and to do it.
Okay.
Yeah.
Now I have a Chinese question. I tried my best to translate, but Professor Chen, you can look at the Chinese. Okay. So the question from the social media, they're asking now when people get old, just like what you show in your PowerPoint, in the Chinese medicine, there's some theory about qi and about they are very weak and also stagnant of the blood. Okay. So how does that relate to healthy aging? Okay, so what do you think? Meaning the relationship between all these conditions and healthy aging, is it because it's not healthy, so they get this way? I think probably that's the question.
Well, yeah, I think as I said, like when one grows older, then there are deficiencies in your qi and yin and yang, and your blood circulation become a little stagnant and so forth and so forth. And well, these are, from the Chinese medicine point of view, these are natural conditions that happens when one grow older. But of course, this is not a desirable condition. In Chinese medicine, you always need the equilibrium, you always need a balance of all your internal components. So when your internal components becomes imbalanced, then that's not a good sign. And and with that, you may develop into some unhealthy conditions. I think that I'm not sure what the question is
well,
but that's so the overall goal, of course, is to restore the balance of your qi, of your
so that could be like a
blood.
target for intervention, you think?
Oh yeah.
Okay.
Yeah. So to strengthening your spleen, strengthening your stomach, and those are the targets, and to restore the normal condition, normal functioning.
Okay. All right. Thank you, Professor Xie.
Thank you.
I do have another question, but because of time, we probably would like to conclude now. Okay.
Thank you.
Again.
Thank
Okay,
you.
thank you.
Well, thank you again, Professor Che, for your wonderful talk. Please, everyone, please give Professor another round of applause. So to express our appreciation to you, we make this special souvenir for you with your title of lecture and so on it. So I'd like to thank Professor Wang for moderating the Q&A session. And many of you know that we at the pair organize the distinguished lectures and seminars from time to time. So I'd like to invite all of you to come to our next one. I believe will be announced very soon. And I'd like also to take the opportunity to thank you all for your participation and hope to see you next time. So this seminar is adjourned. Thank you very much.